Okay, good morning, everybody. We are here today for a briefing primarily on corona issues and related issues. We'll touch on some others if needed. Want to mention that because the rates have been getting so high, you might recall there was a time, it's hard to actually even remember, when there was a need to actually disseminate information daily with respect to COVID. And so over the course, probably over the summer, that need kind of went away, and we weren't doing as many regular updates. So we will continue to update the public as needed. And I think where we're at now is, at least for the next month, we're going to do a corona briefing every Tuesday at 11:30, roughly 11:30. And so just want to let folks know to kind of expect that. And so we'll try and also both preview what's coming in the future, but also catch up on what's happened with respect to either state public health orders or our numbers and so forth. And so that's what we're going to begin again with today. So let me give some updates from our Emergency Operations Center as a reminder. This has been in effect under our emergency order since March. And so it never went away. We haven't been talking about it as much, but it still is playing a very, very critical role. And now, because of the rise in rates, we're going to be referencing them quite often in some updates, again, from our Emergency Operations Center. And for those of you in the media, you'll know that this information comes to our Joint Information Center. The acronym is the JIC, so we refer to that quite often as well. So some updates from the JIC to start out with, and then we are going to touch on the outbreak at our homeless shelter on the west side. So we do have the city's appointed medical expert on that here to talk about that, and we're also going to be talking about the emergency PPE that we're finally getting out to the public just in time. So let's begin with some general updates. The fire marshal visited each voting site, over 60 sites, to set the occupancy loads and also get them up to speed on requirements. And so we're set up for early voting, of course, which the formal early voting across the county starts this Saturday. And so we're going to be set up for COVID-safe practices there. That's being overseen by the fire marshal. A little bit of an update on enforcement over the last 7 days. We had 76 interactions with businesses and individuals, heavily weighted to individuals who weren't wearing face masks and businesses that weren't requiring them. And so just as a reminder, we do require businesses to help us enforce the face mask rule. So note businesses that, again, you're part of the solution to help enforce that, and you have the right to require a mask for anyone who enters your premises, and our fire marshal's office can help walk you through that. Now, also, of course, restaurants, it's important to remember, try and wear your mask, especially like if you're waiting in line to get seated in these kinds of situations. Technically, really it shouldn't be until food or drink arrives that you take your mask off. Now, we're also continuing to hand out lots of masks as needed. And we'll touch more on some great community partners in a little bit that are going to be zooming in to discuss that effort. Now, I want to mention that our State Department of Health is still doing COVID testing, of course, Monday through Saturdays at Expo, New Mexico. That's been probably the most stable and accessible site for general purposes for central New Mexico. And they'll test basically anyone who requests a test. And that is a great thing, by the way. Very few cities, very few states can offer that. I'm glad we still can, and obviously it goes a long way to help with what we're dealing with in the pandemic. They're also hosting an adult flu shot event on Saturday, this Saturday, October 17th at noon, and it's just first come, first serve to get a flu shot there. I want to mention also we continue to see problems in nursing homes coming back in a big way. This was a huge issue before, and we continue to track this. I think at least we're in a better place as a community to help deal with these outbreaks. But we have 11 nursing homes reporting 144 residents with cases and 79 staff, and of course 24 deaths. So nursing homes continue to be a real problematic situation for us. Now, we'll talk a little bit about sort of inherent risk, but it goes without saying that when rates are this high, when they're going up this high, there are going to be positives. People that we know, people that we work with, there are going to be positives in our workplace. If you're an essential worker, there are going to be positives in nursing homes. There are going to be positives in our medical facilities and in our homeless facilities. These are inevitable. The important thing is how we deal with them and how we contain them. And of course, ultimately, how we prevent a loss of life. But I want to remind folks that whenever we see a spike like this, no one should think they're immune. And there are very high-risk situations which sometimes we can't avoid, like the jail, where these situations are simply going to happen. And the question, the key is how we deal with them and how we minimize them. There's no way you can prevent outbreaks in a lot of these environments when rates are going up the way they are. Okay, now let's talk a little bit about where we are in terms of Albuquerque, at least the metro region. And so our Dr. Mark Domena is actually going to run through a little bit on this. Why don't you come on up, Dr. Mark Domena.
Thank you, Mayor. So again, this week, we continue to be going a little bit in the wrong direction. We do know that this is a national trend. There are something like 29 states that are all on an upward spike right now, all seeing great increases in case counts and kind of going generally in the wrong direction. Most importantly, as we emphasized last week and as Mayor touched on just now, that brings us to a higher and higher plateau, which we're going to be leaping from as we get into cold and flu season and colder weather. So that's a concern for us. State frequently is reporting on these gating criteria, and several of those were now in a place where we don't want to be. The test positivity rate for New Mexico is now at 5.3%. That was just updated from the Department of Health earlier. We would want to see that at 5%. The spread rate for the metro region is at 1.36, and that's above where it needs to be also. It's about 1.26 for the whole state. So these trends going in the wrong direction we want. We also had about 8.8 cases per 100,000 as of late last week, and wanted to keep that under 8. So I think, can't quite see this, but I think this is showing the cases per 100,000 that are going up significantly. You can see we were at a high point earlier in the summer, kind of following 4th of July, some of the summer activities, and we did a great job as a state of bringing that back down, being under control, but we're starting to get back up there again where we don't want to be. I think it's important to provide some context for that. New Mexico in general has done very well throughout this entire situation. So we are starting from a good place to begin with. Other states, when they're increasing, were already, maybe even at a higher level, so they may not see the steep trajectory that we're seeing. So we're just asking people to go back to doing all of the protective things that we were doing. We know as a state and as the city that we can do the things that we need to do to beat this back again. The metro area is a little higher than other parts of the state. As we've talked about throughout, there's a huge population center here, so that's to be expected. There are some other areas like the southeast part of the state that are also very high. But we know as Albuquerque that we can do a better job of this and make sure that we're being protective. Just to emphasize again, this is going to be especially important going into some of the fall holidays. Halloween is coming up. We know people want to do trick-or-treating and that kind of thing, but there needs to be some thought given to how to do that safely, and we're suggesting that people plan ahead now how you can do something that will still give you the spirit of Halloween without putting yourselves at risk. And then we'll be talking about that going into Thanksgiving time as well. So just want to see that trend level off as best as we can and try to prevent some of the spread that's going on here.
So a couple of things just to note on the graph over here. You can see the two lines that are going up the most. One is the metro, and so obviously with our population, our density, and all the services, we always expect us to be, in a bad way, leading the state in many categories. Although you can see here actually the southeast is having a lot of challenges. They're actually in a worse situation than the metro. But it is a good reminder that, we just have to remain vigilant, and you can kind of see that as much as we've got to do, just remember that just because we have shopping malls, we have airports, et cetera, this is about managing and mitigating risk. It's not about eliminating it. It is inherently going to be in any urban center. So that's why we've got to do the distancing, masks, and all the other stay-home recommendations from the state. Now, a couple of other items. I do want to mention quickly flu shots, which is our next slide here. Continuing to offer a number of options for flu shots. You can get the latest information by calling 311 or cabq.gov. I think folks have mentioned this a lot. There's obviously sort of a connection between the two. We don't want to see an outbreak of flu and an outbreak of COVID at the same time, both for our medical system and for individuals' health. And so it's more important than ever this year that we save hospital resources for fighting the pandemic. This website, if you it's very interactive, so you just click on the dot and it'll show you the times, locations, and insurance information. We also expect a lot more of these opportunities as we get into the end of October and there's more flu vaccines released regionally. Okay, let's talk a little bit about PPE. So as a reminder, this is sort of the masks and gowns and different equipment related to keeping everyone safe. And in our city, we're very fortunate, I think, that we've been able, with council's help, to set up a program that is really going to be able to help our businesses enforce and, in a helpful way, hand out PPE equipment. And so to touch on a little bit of that, I want to mention that our city has established a program to deliver PPE with a bunch of partners, and we're going to hear from them in just a little bit. But I want to remind folks that we are in this for the long haul, and dealing with the pandemic means that the city's got to step up and continue to step up for working families and businesses to help them survive. So recall early on, we were one of the first major cities to release about $2 million in grants to restaurants and retail shops, even nonprofits and artists. And we have an additional $10 million coming. And so more help is on the way. And city governments around the country are demonstrating this, but it's the same here. The city is able to release these dollars in a transparent and accountable way, in a much faster way typically than other forms of government. And so we're going to be able to demonstrate this with the additional $10 million working with our city council to get these dollars out to businesses. So we have a informal timetable. We'll be rolling that out formally probably next week. But we're looking at the first allocations coming in 2 to 4 weeks, and then they'll be rolling in a couple of batches, so we get all that money out before the end of the year. That's $10 million. That is a whole lot of help on the way to the recipients who get it. And again, it's just setting up the sort of the application process, the tracking process that we're doing now, and we're getting close to being able to announce the details on that. So stay tuned. Now, with respect to PPE, we have purchased essentially about $1 million worth of PPE and COVID screening equipment. And we're asking our local businesses, of course, to require wearing masks and do screening. And so I believe the city should help step up and help these businesses be able to do that. And that's exactly what we're now able to do. So we are finalizing some of the contracts with our partners, but our estimates are that we are buying this equipment from local vendors, we're distributing it to local small businesses, and what this actually means in just round estimates is 70,000 reusable masks. And again, this is very important, especially for people who are sort of in these environments like retail space every day, to have a good reusable mask. It also means about 20,000 boxes of disposable masks, and there's about 15 each box. If you do the math, that is over 1 million masks we're going to be able to give businesses, to give to patrons who show up without a mask. It also means about 6,500 boxes of 100 gloves. So you can see that's actually going to be about 600,000 pairs of gloves, and also about 20,000 bottles of hand sanitizer, and also about 13,000 bottles of disinfectant and cleaner. And again, these are for the businesses constantly having to clean display cases, etc., keypads for credit cards. That's what all of this is for. It also means 3,000 no-touch thermometers and about 2,000 plexiglass dividers. Again, another item that is in high demand, especially for small businesses. We know a lot of chains, a lot of multinational corporations, we expect them to be able to do this on their own. Small businesses don't have the same resources, and that's what this program is really designed to help. So the big question when we set up this program was, look, we've got to be realistic when we allocate money and we say we're going to do this. How do we actually get it into businesses' hands? And we've established, I think, a great program to make this actually happen. And it basically involves a lot of our business chambers of commerce and associations who know these businesses the best. So our coalition includes the African American Greater Chamber of Commerce, the Asian Business Collaborative, of course, Albuquerque Hispano Chamber, the Greater Albuquerque Chamber, the Indian Pueblo Cultural Center, New Mexico Out Business Alliance, that's for the LGBTQ community, and also the South Valley Economic Development Center, West Enterprise Center, and the West Central Community Development Center. So these are just a few of the partners that are part of this group that's going to get this equipment into businesses' hands, and we're going to hear from some of these folks who are doing this work today. So in no particular order, I'm just going to start with Ernie Citabaca from the Hispano Chamber, and we'll turn it over to the Zoom board. And just give us a moment here. I think, Ernie, we're good to go.
We're going to hear from some of these folks who are doing the work today. So in no particular order, I'm just going to start with the Baca from the Hispano Chamber, and we'll turn it over to the Zoom board.
Well,
there we go.
Hopefully you can hear me, Mayor. Thank you so much for your effort in helping small businesses here in Albuquerque. Can you hear me okay?
Yes, Ernie, you're good. Go ahead.
Can you hear me okay? Okay, here we go. Well, I'm going to continue to say they desperately need it. They desperately need the help, and the expenses associated with having to purchase the PPE on their own makes things more difficult because, you know, they have to have their expenses for their employees or whatever they need to do to sustain their business. We've had a great relationship with your administration, your economic development director, the city council, both Clarissa Pena and Cynthia Borrego have shown up where we've given out PPE in the past. Back in June, we gave up 500 or so bags from vendors here in Albuquerque who gave it out, who contributed it. That's what's great about Albuquerque is you have a lot of people that are willing to help to make other folks succeed. So I want to thank you personally for this. It's going to be a big help for our small businesses, and we'll make sure we distribute it as soon as we can, as soon as we get it. Thank you, Mayor.
All right. Thank you, Ernie. And next up, let's hear from Agnes Noonan at West.
That's what's great about Albuquerque is you have a lot of people that are willing to help.
Sounds like there should be a little bit of a delay on there. A little bit of a delay as we transfer over.
Good morning, Mr. Mayor. Thank you so much. I just want to thank you and the city council for its leadership, particularly where it concerns both the loans to small business and, of course, the PPP. We know there's so many businesses that are struggling financially and simply can't afford to purchase their own PPP. So we really, really appreciate being able to provide this equipment, this protective equipment to small businesses. And we just want to thank the city for its leadership.
I appreciate that. Thank you so much, Agnes. And now let's hear from Pam Myers from
PPP.
Sorry. Thank you so much for your leadership, Mayor, and for giving us an opportunity to participate and help small businesses in our community, particularly our LGBTQ community. We want to do whatever we can to help them get through this struggling time. So thank you for allowing us to participate and help.
Absolutely. Thank you. And from our South Valley Economic Development Center, Josue Oliveros.
Hi, this is Marianne Miseli Mendoza on behalf of Josue Oliveros for the South Valley Economic Development Center, as well as the Rio Grande Community Development Corporation. And we would just like to say that we are honored to be a part of the city working in this amazing effort. We are a minority community organization primarily focused on the Spanish speaking, and we know how very important it is for all of us to come together. So we're very happy to be a part of this.
Thanks so much, Pam. Josue and the South Valley Economic Development Center. And next up from our local Black Chamber, Teresa Carson.
Thank you so much, Mayor. The African American Greater Albuquerque Chamber recognizes the importance of this program because this is a very unique time where we're all challenged to ensure our local businesses, workers, and customers are kept safe while open and operating through this pandemic. We are grateful to the City Council and the Mayor's Office for this PPE supply program and their response to the needs of our community. This outreach effort sends an important message, I believe, that we are all working together. These supplies will provide some relief to the stress we know that our small businesses are feeling. It will also ensure our businesses have the necessary equipment to protect their employees as well as their customers. And it gives them one less thing to have to worry about. And so for that, Mayor, I thank you very much.
I appreciate it, Teresa. Thank you. And with the West Central Community Development Corporation, Luis Hernandez. Luis?
Thank you, Mayor. An honor and a privilege to be here, to be part of this program, really, to help small businesses here in the community. That's one thing that we set out to do. And, one of the ways that we're able to do that is through programs that are directed through the city. So I want to thank you and your administration for putting this program together, for our awesome city councilors for understanding the need and addressing it immediately. But this is very critical, to make sure that small businesses have access, to the public health order required PPE. And a lot of times they simply don't. Many small businesses right now, they're maneuvering, through challenging times. They're being asked to do things that they've never had to do before, and it's making hard decisions when it comes to cash flow. And so the PPE grant really it helps provide them with some breathing room, but more importantly, it really helps us to manage and mitigate those risks that you talk about, and making sure that we're all in compliance with the public health order. So again, from the West Central Community Development Group, we're very grateful and honored for the opportunity to be able to run alongside you and support our small businesses here. Thank you.
Great points, Luis. Thank you. And from the Asian Business Collaborative, Crystal Ciarza.
Mayor Keller and everybody tuning into the live stream, my name is Crystal Ciarza. Many of you know me as a small business owner in Albuquerque called Ciarza Social Digital. But today, we're very excited to announce a new community of color group that is focused on small business, which is the Asian Business Collaborative. It is a new nonprofit that is supporting Asian and Pacific Islander business owners in a cultural competent way. We are going to be partnering with many of the organizations that are in front of us today, like Hispano, like West, etc. But we're extremely excited to be working with the city of Albuquerque on an exciting project to really help genuinely small business owners like myself. We are utilizing our partnership with the New Mexico Asian Family Center to help distribute these PPEs because the Asian community has been left in the dark about business needs and business resources simply because of communication, language barriers, and cultural competency. So thank you to not only Mayor Keller for constantly supporting the Asian community, especially in a situation like this. Thank you to Councilor Sena and also Councilor Davis for their continued support for the Asian community. And for those that are looking for more information or know of an Asian business that needs our help, please don't hesitate to visit our website, asianpibc.org.
Awesome. Thank you, Crystal. Glad to have this organization set up for so many reasons, and especially now in a time of crisis. Okay, appreciate all the guests who joined us over Zoom, and we all miss getting together personally, so it is great to hear your voices and see your faces, and thanks for all you do in the community, and especially for helping out with this program. So hopefully we'll see how it goes, but hopefully, you know, PPE for small businesses will not be a challenge in our community. That's the goal. We'll see, of course, that depends a little bit on supply and demand, but this, 1 million masks should go a long way. So, all right, let's transition a little bit. We do want to touch on our Westside homeless shelter and the outbreak there. And we've been disclosing appropriately the numbers and the challenges that we've been having out there. So I'm going to touch on a few basics and then bring up Dr. Parajon, our city's medical director, to talk a little bit about that. Now, as of this morning, our medical staff at the Westside Emergency Housing Center confirmed 98 positive COVID-19 cases. That is 84 residents and 14 staff. And only one hospitalization. As a reminder, the Westside Center has a lot of staff from a lot of different organizations that are part of our sort of caregiving team out there. And so a lot of them are city contractors or UNMH affiliated folks and nonprofits. So there's a lot of different groups that work out there. Now, in the last week, we've performed more than 230 tests. And so want to mention that for us, you know, we were way out in front early on when COVID hit. Number one, the city appointed a medical director, which was I'm so grateful for Dr. Parajon and for the city. For us, I worked on this with our CAO and, of course, Carol Pierce at Family Community Services, but that, I believe, has literally saved lives. And so we were prepared for this early on. And this, unfortunately, is the first time we've really had to use a lot of these protocols. But I think the fortunate thing is we have the right personnel and the right protocol in place. Now, we also, again, we knew this was going to happen, right? There have been massive outbreaks among homeless populations all around the country. And it's actually surprising it hasn't happened yet in Albuquerque. But of course, it's been a good thing. But now the outbreak has finally happened that I think many of us thought we would see back in both the spring and the summer. And so we are doing everything we can to help every single resident. And the initial cases were caught by the screening process that we set up again back in the spring. And so we moved quickly to isolate these individuals, to do contact tracing, and additional isolation and testing is needed, and to ensure that these folks are receiving food and medical attention and time to recover. And as we've shared, a lot of these folks are now in isolation in hotels, which is actually a great place for them anyway. And so we appreciate our hotel partners for that. That's something we have been doing since the beginning of the outbreak, but of course right now we're having to do on a much larger scale. Now, we're not out of the woods yet. We know that, we had a couple of cases early on in April, but I think in total we've only seen about 100 cases among residents and staff. So you can see basically almost all of that has been in the last few weeks. Now, we do know there are some projections that are done by the National Alliance to End Homelessness. And for Bernalillo County, the estimate was we probably have 650 positive cases. So what we are and have been preparing for is 650 positive cases. So while we are very concerned and moving as fast as we can with these 98 positive cases, we are prepared for 650, and we're also grateful that we haven't had anywhere near that so far. Now, I really appreciate the partners who've been involved in this. This is something that really takes a community and local government. And they have worked very hard to prevent more serious community spread and to respond to this situation with speed and decisiveness. And that is what we continue to do with respect to all things COVID. Now, for us, too, we, again, have a doctor sort of in charge. And we really appreciate UNMH for lending her to us, Dr. Parajon. And I'm going to bring her up now to share more details on the outbreak. Doctor?
Hi, thank you very much. Thank you very much, Mayor, for inviting me to be part of this. We're so grateful at the part of UNMH to actually be part of the Health Sciences Center and UNM to be part of this amazing community partnership to help reduce the spread of COVID-19 for people experiencing homelessness. So I'm just going to share with you a little bit of an update. As the mayor said, we experienced 98 COVID positive cases since last week. Up until then, we had only had 3 positive cases inside the shelter. And that's thanks to the leadership of the city, the State Department of Health, all our community partners, our medical team with Albuquerque Healthcare for the Homeless, First Nations, UNM, and also Heading Home, working together at the shelter to basically screen every person who came in, both temperature and symptom screening, being able to identify anybody with symptoms and isolate them right away. We have a shelter, a hotel, where we were able to put people in isolation because people experiencing homelessness can't shelter in place, in their homes, they don't have a home. And then we're also able to, thanks to the city, have a place where we could put seniors who are most at risk at a wellness hotel. So if you think about our systems, it's 3 different systems, right? It's a Westside shelter where we're screening people and having a safe place for them to stay and be able to put people in isolation who needed to be, a hotel, as well as a wellness hotel. So thanks to the city, the state, and everybody, all the partners, we were able to go for a long time without any positive cases inside the shelter. What happened last week was that like the mayor said, it's a reflection of the overall high community spread. So we didn't just see one positive case, we saw multiple positive cases throughout the whole shelter. And so while we did try to contain that, it had already spread within the shelter. So the good thing is that currently all high-risk individuals who have been tested positive are now in a non-congregate hotel setting. Some of our low-risk and non-symptomatic people who are positive will remain inside Westside Shelter, but with good surveillance and monitoring. There are approximately 270 people inside the shelter when we started the outbreak. So it's a testament to the whole work of the whole system that we didn't have more people turn positive. At the moment, everybody we have remains stable. Actually, we were just having to send 4 people to the ER right now because, and this is what's really great, we had all those people in the hotel system near the hospital, so we were able to send them right away to the hospital. And so that's very good that we're taking out the people who are senior, COVID positive, who could be most at risk. Our medical team right now, like I said, UNM, First Nations, Healthcare for the Homeless, Heading Home, Medical Reserve Corps, and the State Department of Health are providing the surveillance, the behavioral health, and medical care. And we also have the National Guard helping us as well. So this is a huge community partnership that has been doing amazing. Everyone's getting 3 meals, snacks, some medical support, thanks to the support of the city, state, and all the community partners. Contract tracing is happening as well to help slow the spread. And like I said, I'd just like to say this is an amazing partnership. Thank you so much to the city to lead this, the state, and everyone else, all the community partners that because we've been working together since March, we've been ready for this moment, and we're working and trying our best to contain and support the people who contain the spread and support the people who need it the most. Thank you.
Thanks, Doctor.
Sure, thank you.
Okay, thank you so much, Doctor. And one item I would just mention, if there are questions too, we get a lot of questions about hospital bed availability and so forth. And I think in general, I would just share that the sort of basic level of beds is being stressed, but the state and all our hospitals have done such a great job of having flexible capacity. And so there's still plenty of that. So that's sort of good news, but also a little bit of a note that, the sort of just standard number of beds available is getting stressed, but we have lots of flexible capacity in the system. So that's good for our state, and appreciate everyone being prepared for that in case we need to use those. Okay, so I think with that, we'll try and take some questions here. So I think Maya's on deck today. Go ahead.
Yeah, I have a question from Ryan Laughlin with KOV. With colder temperatures coming and and the spike of COVID cases, what is the city doing to balance the needs of the homeless community while keeping them safe from the virus?
Yeah, the question is about balancing the needs of the homeless community during cold weather and also during the virus. And I think I want to emphasize a great point there about balance. That's the key, right? We have to balance both of those things. And so in a particular situation where obviously there's something like an outbreak, we want to encourage folks to work with the individuals who do outreach and find somewhere to go to get what you need, whether it is tests, whether it is food and shelter. And there are multiple providers. So the good news is there's lots of other providers that are available to pick up the slack. And then as soon as the outbreak is sort of contained and the situation is back under control, then of course the Westside is one of the best options, as it has been for many years during winter. Recall it was originally called the winter shelter, because that's when it only used to be open. Now it's been open 24/7 and even serving food. So anything else you want to add on that, Doctor? It's okay if not, but.
What you said, yeah, just keep on, sorry. Yeah,
sure, if you want to come up.
Okay,
yeah.
Sorry, yeah, I agree with
It's
you.
okay.
Just keep on, I think that's one of the things we're working on. The city has already done a lot of work in helping decrease the density. Oh, sorry. The city's already done a lot of work in helping decrease the density. So we have a special area for seniors, and then we've been making sure that people are only staying on the bottom bunks. So we are working hard on that with the city, and I think that's a really important point to say, how are we protecting people for the winter? So yeah, thanks.
Last thing I would mention is, as we have been doing, we do have some flex capacity in different city facilities, whether it's a senior center or a community center. Those are all closed except for the ones that are open for taking care of kids. But we also have planned for not only hotels as the first bet, but if we just need to separate the population into pods, we can do that. We did that before.
I have another question from Madison at KRQE. Is there a team going out to homeless camps and testing there, or only people seeking help at the shelter?
Question is there a team going out and doing testing, or are these only happening at shelters? And remember, there's multiple shelters all over the city. So it's a good question. Doctor, do you have the answer to that?
Yeah, Healthcare for the Homeless is doing that.
So Healthcare for the Homeless is leading that side of the testing effort. All right, Jessica.
Are you requiring masks at the shelter of the residents at all times? Has that been the case throughout this? When did that change?
So the question is about masks at the shelter, and Dr. Parajon can take that.
Hi, so we did really want to have them have masks at all times, but it's exactly the same thing that happened in our general population happened in the shelter, right? At first, everyone wore their masks and they were really concerned. And then during the summer, people just kind of like lapsed on it. So it's not just people experiencing homelessness not wearing their masks, like a lot of people weren't wearing their masks. So what we did just recently is just have that as part of the program to wear your mask while you're in the shelter. Sometimes it's very hard for people who have COPD or other asthma to wear their masks. So we also helping some of them with face shields. Is not as good, but the more people wear their masks, the less transmission we'll have. But wearing the mask is really the main thing we need to break this transmission. So everybody's wearing a mask now at the shelter. It's very, very good.
As of last week?
As of last week when this whole outbreak started, we began to require, once we had the first case, we then began to require that everybody wear their mask. Yeah.
Even when they're sleeping?
Not when they're sleeping, but when they're we're also really practicing social distancing, so making sure people are 6 feet apart, and that's really hard to do. People want to congregate, but we just keep on saying, stay 6 feet apart, wear your mask. Yeah.
Are the beds 6 feet apart?
The beds are not 6 feet apart regularly because we're working on that, but we have head to toe. So that's actually what makes it 6 feet apart. And then what we're doing right now, because of the outbreak, we're actually spreading them out in through the beds, through the system, to make sure they are 6 feet apart. So that's what we're working on. Yeah. But it's, yeah.
Can you talk talk a little bit about your screening. I know you
Yes.
take temperatures, you ask questions. At what point is that before they get on the bus, or is that before they walk into the shelter?
So yeah, once again, this is an amazing partnership. So basically what happened is that the city worked with the bus system. And so we got everyone who, before they get on the bus, they have masks available for them to wear. And we spread people out on the bus so they're not, all squished together. They're all spread out. They have to use hand gel before they get on the bus. Then when they get to the shelter, we have a whole team there. We train the shelter staff, who are amazing, by the way, Heading Home Blue Pod team, shout out to them. They screen people when they come in, every single person, temperature and symptom screen. And then if anyone is screens positively for that, like they have some symptom, then we move them not through the shelter, on the outside of the shelter, to an isolation area in the back of the shelter. And so that area is called Blue Pod Isolation Area, and people are very well cared for back there. Our team, it's not just a team that just screens people, right? It's a team that cares about people and cares that they have a good stay when they're at the shelter. So, does that help?
Are you encouraging people to stay there right now?
We are, because we want to take care of them, right? So right now, some of them have COVID. Some of them are awaiting their test results. They were negative, but because they've been exposed, we're awaiting their results. So we have a medical team that's caring for them there. So yes, they're providing, the city and the state, everybody has chipped in to provide shelter, hot meals, and medical care for everybody. So we're trying our best, but people are concerned. We've gone and talked to everybody in the pods. We're just trying to support them. We also have peer behavioral health for them, so we are able to support people in there. So what's been amazing about this response is, in a very, very short time, the city, the state, the community partners have been able to pull this all together. You can't imagine the logistical difficulties that has led to this, but it's incredible. Everyone's pulled together. It's amazing. So thank you to the mayor, thank you to the state, thank you to everyone who made this happen. Yeah, State Department of Health, everybody. It's incredible. Oh, Secretary Blaylock got us a National Guard. So it's been amazing.
All right, thanks.
And another question that might be for you too. You said that you're encouraging people to stay. Have some residents chosen to leave? Yeah.
Mm-hmm. So, yeah, just to reiterate, the question is about, some residents, of course, have chosen to leave, but because they've been exposed, just like anyone else, it's actually better if they stay in touch with us. So we're encouraging that, but they're always free to not come. Okay, I know we're a little short on time, but we have time for a few more. There's one on, Maya, what's next?
I'm good on Zoom.
Okay, go ahead.
The $125,000 the council allocated to the Inspire Chamber for PPE in June, is that separate from this $1 million that you're talking about today?
Questions about funding that was allocated to the Chamber of PPE earlier, and it's a great question. That is a level of detail that I'm sure economic development can answer, so we'll get you an answer to that question. I don't know off the top of my head.
I actually have one more from Marissa Armas. If things get worse, will we close the shelter entirely?
So the question is, if things get worse, will we close entirely? Doctor can speak to this a little bit, but remember, because these folks have been exposed, closing the shelter entirely would then put them at risk for exposing the rest of the city. So that's certainly something we do not want to do.
Yeah, and the other thing that, I've worked in the shelter now for a year. The shelter is like the last place people go when they don't have anywhere else to go. And so for us, trying to do that balance, strike the balance between having a shelter for people who have no place to go and taking care of them as best we can in a congregate setting is kind of what the balance we're trying to do, is caring for people, our most vulnerable neighbors in our community. So I do think it still should stay open. The question is how do we want to keep it open in a safe way? So that's what we're working on.
Okay, thanks, folks. We'll pick up all things COVID next Tuesday at 11:30. Thank you.